An incredible panel, and we're delighted to have all of you with us. We've got Justin Madders MP, who, as we know, is the Shadow Minister for Health and Social Care. Welcome, Justin. We've got Councillor Sarah James, who is our own Haringey's Cabinet Lead for Health and Care. Welcome to the meeting, Sarah. We've got Martin McKee, who is Professor of European Public Health at the London School of Hygiene and Tropical Medicine. And Martin is also a member of Independent SAGE, and they have played, I think, a really vital role during the COVID pandemic. We've also delighted to welcome Parth Patel, who is a doctor and a research fellow at the Institute for Public Policy Research, the IPPR think tank. And we've got Charmaine Smith, who is a local social carer and campaigner. So before I introduce the speakers, just to introduce the topic. So we're obviously here this evening to discuss the NHS. And we know that the COVID pandemic has had a devastating effect on our lives and our livelihoods. And I'm sure we'd all like to take a moment to thank all of those who work in the NHS and in the social care sector. We know that COVID has had a major impact on the NHS and social care, which was already struggling after a decade of cuts and underfunding. The government response has been to bypass local public health, councils and other public bodies, and has opted instead to waste billions of pounds of taxpayers' money on private companies who often have precious little experience in health provision. And we know that that has had devastating results. So with our speakers tonight, we want to start to explore exactly what has happened, and crucially, we want to discuss what we can do together in our campaigning to prevent any further damage to people's health and healthcare services. So I'd like to introduce our first speaker, Justin Madders, our Shadow Minister for Health and Social Care. Justin may have to leave shortly after 8 o'clock, but we're delighted that you're with us this evening, Justin. Thank you very much for joining us, and the floor is yours.
Thank you very much for the introduction, Celia, and it's good to see so many members here. And I know we can't meet in person, but the interest and love for the NHS and social care that Labour Party members have is clearly still there. So as you've said, I'm a Shadow Health Minister. My full title is Shadow Minister for Secondary Care, Workforce and Patient Health, which covers a whole range of issues, the finance side of things, the estate itself, that's the buildings, and the capital side of things, operational performance, which is something that is not really where it ought to be or where we'd want it to be. Workforce as well, which is really one of the big key issues, which I'm sure we'll touch on as well as some specific issues like maternity services. So we've got a new Shadow Health team from April when the new leadership took over. John Ashworth has been obviously the Shadow Health Secretary of State for some time now, and I served under him since 2015 actually, under various Shadow Secretaries of State, but I got reappointed in the April reshuffle, and as you would expect, it has been busier than ever, and most of the everyday things that we talk about in the NHS have kind of took a back seat for the last 6 months, as you would expect, and really we've been dealing day to day with the very many challenges that COVID-19 faces. And what I just wanted to do is just go through some of the things where we believe the government have failed actually, and we tried to strike a supported tone, but there have been many mistakes made. So I'll just list some of those at the start. We don't think the Prime Minister took things seriously enough. We know he missed 5 Cobra meetings in a row when the threat was being discussed. We know that warnings about the nation's preparedness for a pandemic were not acted upon, and that's part of the exercise Cygnus report, which some of you will be familiar with, which I think has now been released, although the government's response to that has yet to be circulated. Part of that was that PPE stockpiles were run down. We know that once the virus entered the country, lockdown was delayed. There was no real attempt to check people coming into the country, whether they were bringing the virus with them. Contact tracing was stopped back in March, even though that was proving to be effective in the limited way it was being used in the early stages. We know that we had the disastrous experience of people being discharged into care homes without being tested, which led to many excess deaths in the care home settings. We allowed some of our PPE to be exported whilst we were seeing the shameful spectacle of the doctors and nurses bringing in homemade PPE. We ignored WHO advice to test at the start. We got into a silly situation where Matt Hancock was following quite arbitrary targets to get an X number of tests done each day, rather than actually look at making sure it fitted into a workable system. We then went our own way in preparing an app that abandoned something 4 months later, half a job. We then, as has already been decided to go down the private sector route, the majority of the contact tracing process. I think that was a disastrous decision. We know the performance figures on that have been well below those that the local public health teams have been able to deliver. And I think one of the reasons why we are still talking about severe restrictions is because test and trace has not worked to the level that it needed to. We have dilly-dallied on advice on face coverings. We didn't join cross-EU PPE procurement processes. You've probably seen many of the strange, if not downright nonsensical decisions made about which companies were going to get these PPE contracts. Some of them, many of them have had no previous record in this area. Some of them have got close contacts with Conservative Party figures, which I think has added fuel to the fire that this has been a very good pandemic for some people who have took an opportunity to make an awful lot of money out of this. We're still really grappling with the decision to go with Serco and Cytel in terms of contact tracing. The Prime Minister announced an extra £7 billion going into contact tracing yesterday. We haven't got much detail as to what that means yet, but it will probably be going in the main to the failing private providers who we know at the moment are failing to contact around 40% of the close contacts to people who have been infected. And we know COVID exacerbates existing health inequalities, so it's causing mass distortions in the system. We know that it's causing a massive backlog in elective surgery and cancer care. Many issues of mental health are remaining undiagnosed as well. And we have a workforce that is frankly burnt out from the demands that have been placed on it, and has really been given very little support other than a clap and a badge from the government. Now, we think from what has been suggested that they will not be subject to the same public sector pay freeze everyone else will be, but we'll see what the Chancellor says tomorrow on that. But if they do face a pay freeze along with everyone else, then I think that will send the most appalling message about the incredible work that they've done, an incredible sacrifice actually, because we shouldn't forget that over 600 health and social care staff have actually died from COVID, contracting it in the course of their duties, many of whom have not actually received any of the compensatory payments that they're entitled to. And we know that there are existing workforce challenges anyway. We know there's still around 100,000 vacancies across the NHS. Absence levels are quite high, partly due to stress of work, but also because of people catching COVID and therefore having to self-isolate, or actually another person in their family catching it. We know that there are tremendous challenges in terms of the NHS long-term plan, which have been laid out, but there's been no real workforce plan to go alongside that. The government have set out a very, very broad, what they call people plan alongside that, but it's not actually been costed. It's not really been set out in any detail. And we know that there are many challenges moving forward in terms of actually delivering an NHS to the standard we would expect, in terms of actually getting the right numbers of people in each specialism over the next decade. And at the moment, there really isn't a route through to delivering on that. And I am very clear that if you don't have the right workforce, you cannot deliver the NHS that we all want to see. So in terms of some of the issues with the current privatisation agenda, we know that there are still a number of what we call subcos, which are effectively private companies set up by NHS trusts to deal with quite often some of the more facilities management type things that trusts have to do. There's a VAT advantage to them in doing that, which is why many have been set up. And of course, it's actually a circular argument, because it's the Treasury who get the money back in the VAT anyway. So there are proposals to actually change the rules on that from next April. We will wait and see if that's delivered. We know there's about another 30 trusts looking at setting up subcos if the VAT rules don't change to create a level playing field, because there's massive advantage to a trust in terms of the savings they can make just from VAT alone. But of course, in the longer run, what it does allow is for further fragmentation of the NHS and more terms and conditions being dictated to by the private sector outside of the NHS. So that's one area of concern. We have an ongoing emerging picture in terms of what's happening with CCGs. We know that there is a trend to merge more and more of them, go and create larger and larger bodies. Almost, certainly in my area, if you take Cheshire and Merseyside, for example, that's a population of just over 2 million people. It's currently got 9 CCGs. That's already come down from, I think, 13 before. The proposal is that becomes one CCG. Effectively, the SDP footprint is for delivering health and social care. That's not really been anything that has been the subject of any public discussion. At the moment, there is resistance and pushback from many of the areas who have been led down this track, but these health and social care partnerships have emerged instead, which are something that is entirely a legal fiction, in the sense that they do not have any formal standing, but they are effectively the CCGs in the SDP footprints being brought together to discuss whole area priorities. And I think whilst they may not have any legal standing at the moment, I would be unsurprised if next year's finances are actually channeled through these partnerships, so that actually they become the all-powerful body by default, and without any legislative backing. We know that integrated care systems are something that have been developed across the country in slightly different forms, and there's no legislative backing for those either. All these things need much greater transparency and scrutiny on them, because lots of decisions are being made away from the public's gaze, and there's no accountability at the moment for these things. But in the meantime, we've got the challenge of COVID. Clearly, there is going to be a lot of talk in the next few days about which tier each area is in, and certainly from an economic perspective, most people would be very concerned about going into the highest tier, although it looks like it could well be the case that lots of areas end up in there anyway. What we need clarity on is the basis upon which places are going to be placed into particular tiers. We know the government set out the 5 criteria that they're going to use, but we don't know how those are actually going to interact with one another and what weight each will be given. We don't know how areas will be able to get out of those tiers, and we don't know what support will be provided for areas to get out of the highest tier. Now, we know there's talk about some mass testing, but even at this stage, we don't know who is going to deliver that. We don't know what level of mass testing will be available, whether people will be able to be tested every day, every week, or even less frequently than that. In the Liverpool pilot, it was all delivered by the army. It's not realistic to expect that to be replicated all over the country, and it may well be that our old friends in the private sector get their hands on that as well, when I think it's pretty clear that if local public health teams were properly supported to deliver mass testing, that would be the most effective way to deliver it, because there have been, shall we say, mixed results from Liverpool so far in terms of its effectiveness. And actually, at the moment, I think the government haven't really articulated how they see mass testing working in the context of getting transmission rates down, particularly when you consider that actually 40% of people aren't being contacted when they're contracting the virus in the first place. So there's nothing to suggest that they would be any more likely to be picked up in a mass testing regime. On top of that, we've got the vaccine rollout, hopefully. Clearly, the vaccine has to go through some further regulatory processes. That's a massive logistical challenge for the NHS, particularly if it's the Pfizer vaccine that appears first of all, because of the temperature it's got to be done at. We know that not every areas had a GP practice come forward to volunteer to deliver that. So again, we do wonder where that will end up being rolled out and who will be doing that. And clearly there's a question mark about what happens to all the other pressures on general practice in the meantime whilst this vaccine is being delivered, and we know that will have a knock-on effect in terms of referrals to consultants and so on. So there are lots of immediate challenges, lots of medium-term questions, and of course lots of long-term issues that are really not being dealt with at the moment, but hopefully that's a helpful run through of where we see things at the moment. There are 10 principles that the Health and Social Care Commission that the party set up have basically agreed on, which I can just go through quickly. So it's, at the moment it's very broad brush, because I think we realistically don't know where the NHS is going to be by the time the next election, but I think most of these principles will be ones that members will be fully on board with. So healthcare should be universally available and free at the point of use. I mean, I'm not sure we need to even say that, because it's so obvious. We need to restore accountability into the health service, which needs to be directly to the Secretary of State. We need to rebuild publicly provided NHS services and reverse privatisation. We need to restore the performance of the NHS and ensure high standards for patients. We should value workers. We should tackle health inequality. We should focus on prevention, of course, deliver a sustainable future for social care, support unpaid carers, and support the nation's mental health. So they're all the sort of 10 principles that the Commission has agreed on so far, and I'm sure no one would disagree with any of those. But I hope that's been a useful run through of some of the issues that the Shadow Health team are grappling with at the moment, and I look forward to hearing the rest of the presentations.
Thank you very much, Martin. That was really thorough and comprehensive, and really helpful to get those 10 principles from you, because that's something that we can obviously use in our campaigning work, and all things, as you say, that I'm sure we all support and agree with. So what I'm going to do is move on to Councillor Sarah James next, and then we'll have a little break and we'll take some questions, and then we'll go on to our further speakers. But if I could first of all call on Councillor Sarah James, who is Haringey's Cabinet Lead for Health and Care. Welcome, Sarah, and the floor is yours.
Okay, thank you very much for inviting me. I was asked to say a little bit about test and trace in Haringey. And then perhaps I'll also just say a little about, from our point of view, what perhaps the key issues are right now. So I hope you can hear me, because I've got a big message flashing up across my screen saying my internet connection's unstable, but unfortunately I can't do anything about that, so I'll carry on. So at the moment in Haringey, we've got three tests.
Sarah, I'm sorry to interrupt.
Yep.
Would it be possible just to adjust your camera? Because we might have people lip reading, and at the moment we can only see the top half of your face.
Yep.
That's it. Perfect.
Sorry,
Thank you very much. That's perfect. Thanks very much. And
All right,
sorry for the interruption.
Okay.
No problem.
So what I was going to say is, at the moment we've got 3 test centres in Haringey, one at Ali Pali, one at the Irish Centre in Tottenham, and one at Stamford, the old Stamford Hill School site in Seven Sisters. All of those operate through the national portal. So if you need a test, you can book one through the national portal at any of those centres. It now seems, it wasn't the case a few weeks ago, but it now seems from feedback I'm getting that there isn't a problem in accessing tests in the local area. So that's some progress. I think what still remains an issue is the speed at which people are getting results. So you can wait up to 5-6 days for a result, which obviously it isn't good at all, especially if you're vulnerable, or if you're working with potentially clinically vulnerable people, or living with somebody who is, or you're having still to travel to work and so on. So that's obviously an issue. Over the 7 days to the 15th of November, so that's, this figure's about a week out of date, should be getting new set in. We conducted, or 3,653 tests had been conducted, 391 were positive. That's a rate of 145 per 100,000. That was up from the previous week, where the figure was 131 per 100,000. These figures, though, are a little below the London average, but they're kind of in line with it. So it's not that we're doing significantly better than elsewhere in London, but we're not doing significantly worse either. I am concerned, though, that people don't think that that means everything's okay now in lockdown, because it clearly isn't. And we only have to look a few miles east to Havering and to Redbridge, and they're having their rates of infection are significantly worse. In Havering, it's 388 per 100,000. So given the mobility in London and the links that there are from one area to the next, things could change very suddenly in Haringey itself. So we need to continue to be really careful. The NHS, as they like to call it, but I think as we generally know, it's Circle and Site-held track and trace system, has confirmed 3,188 cases in Haringey so far. Of these, approximately 77% have been contacted. From the contacts that have been identified, from those initial cases, there are nearly 7,000, of which are just over 4,000 have been contacted. So that's only 58%. Those figures don't tell you anything about the time lag between people being identified as either being COVID positive or having been in close contact with somebody who is, and them actually then being contacted by a tracer, and we don't know how long it's taking, and that therefore doesn't really give us a clear picture of the effectiveness of the system. But the headline figure itself of only 58% being contacted demonstrates that actually when we need around 80% to be contacted, it's not working. Another kind of issue I'd like to touch on briefly is about the Track and Trace Support Fund. This is a scheme that the government announced where a payment of £500 can be made to somebody who has been asked to self-isolate after a positive test and is essentially unable to afford to do so without some financial assistance. So we have a fund provided by the government which allows us to pay £500 to anyone in that position. So far, 132 payments have been made under that scheme. There is also now the government says that on that mandatory scheme, they will top the money up as necessary. But there is also a separate pot of money, which is limited to £90,000 for Haringey, which is the discretionary scheme, which covers everybody who doesn't qualify for one reason or another for the mandatory scheme, and particularly for people who have no recourse to public funds. That's a key kind of group here. We've already made 87 payments against that pot of money, but it is, so we spent £22,000 already supporting people who otherwise would not be able to afford to self-isolate. The government said that the £90,000 is the sum total that we will get for that. So by current rate of drawing down that money, we will run out by mid-January. So what happens after that, we don't know. So I think the priorities for us as a council, local council, in kind of dealing with all this, and obviously Justin has kind of already outlined the many and various shortcomings of government's response to COVID, so I won't kind of repeat them or rehash them, but simply please assume that I endorse all those points as being gross shortcomings of government. I think from our point of view, one of the key priorities is, well, we have a number, but I'd like to start with the implementation of the recommendations of the Fenton report that was published over the summer that looked at the differential impacts of COVID on Black, Asian and minority ethnic groups. It was a really important piece of work, and we need to see those recommendations being implemented at the national level. In Haringey, we're doing the best we can to see those implemented locally. We've adopted them unanimously through the Health and Wellbeing Board. We're working with all our statutory and voluntary community sector partners to make sure that they're on the agenda at every meeting and in terms of every action that we're doing in terms of trying to respond to COVID. Another point I want to make is about the clinically extremely vulnerable group. In the first lockdown, they were told to shield and essentially stay home and not go out for 3 months. Those same people are now being told that it's okay for them to go to work if they have to, if they can't work from home. It's okay, they don't need to isolate. They need to take care, but essentially what that means has been outsourced to them as individuals. From our point of view, I think we feel that Labour needs to advocate much more strongly for that group, to have better wraparound support for them, and that for those who are employed, they should get their full salary regardless of the situation, because it's not the situation they're in making. The other points I suppose I would like to touch on briefly is just the wider issues around local government funding at this time. At the beginning of the March lockdown, local authorities were told by Robert Jenrick to do everything possible to support our local residents through what was clearly going to be a huge crisis, and that they would pay whatever it took. Ever since then, they've been backpedaling on those promises. Everybody's budget is extremely stretched in local authority after local authority. The questions are all about funding gaps. We've seen what happened last week to Croydon, essentially declared bankrupt, and every council in the country is struggling. and we need the government to step up and provide funding for local authorities. We need funding for adult social care desperately, but we also need broader funding that recognises the enormous loss of income that local authorities have had due to this pandemic. So that's, I think, a really important point. The government's wasted 12 billion on track and trace. They've dismembered public health in England and put Dido Harding, whose main qualification seems to be that she was a jockey and the ex-boss of Talk Talk, in charge of the biggest public health programme in the century. Private providers, as we've already heard from Justin, have done very well out of this pandemic. They can't deliver, but yet they just get rewarded with more contracts. We just heard another 7 billion going to track and trace. What we want are properly funded public services that can do the job of supporting our local residents in a way in which the national government is just not doing. We've, during the first lockdown, we delivered thousands of food parcels, medicine packages, we secured PPE for care homes. We worked really closely with care homes to try and protect them from infections. We've looked after children in care, we've looked after women from domestic violence. We've housed the homeless, we've fed people who are hungry. We've looked after those in need of care, and we've supported carers. We can provide, but we need the resources to do so. And at the moment, we're not getting them. And that's a real worry, not just for the immediate term, but also for the longer term, how the state of local authority finances. So just to conclude, the private sector has clearly demonstrated it can't deliver the goods. Its first thought is about profit, inevitably. I don't blame them, that's what they're there for. But we're in a social, health and economic crisis, and we need public responses rooted in the public sector, using public money to support our residents. And that's what I would really hope that the opposition will be in Parliament, will be highlighting and really driving those points for home in the coming weeks. And just a final plea also is it was in the last manifesto, but we desperately need a publicly funded national care service. And I think now is the time for that. There is public support for it, public understanding of the fantastic job that care workers have done. And we really need to be supporting those people, supporting the idea of having a public care, national care service, rather than this really fragmented, fragile care market that we currently have. So I'll leave it there. I'm happy to take questions, and thank you very much.
Thank you very much indeed, Sarah, and I'm sure we'd all like to pay tribute to the work that Haringey Council has done during the pandemic. I think the scale of the operation that you have put in place to support everyone's needs has been incredible, and you've done that without adequate funding and without central government support. So I know we're all really very grateful for all the work of the councillors and also all the council staff, and we'd be grateful if you'd pass that message back to the staff after this meeting. So what I'm going to do, yeah, thank you. What I'm going to do is I'm just going to take a couple of questions now, because we've still got three fantastic speakers to come, and I want to get on to them quite soon. But I will take a couple of questions because I'm not sure how much longer Justin and Sarah will be able to stay. So if you've got questions, what I'm going to ask you to do is to raise your hand virtually, and that means you've got to go into the click on the participants button at the bottom of your screen. You'll see next to it the number 70. That's telling us there's 70 people in the meeting. So it's the button with 2 little people. And if you click on there, and if you go to the bottom of the list of participants by scrolling down, then you'll find a button that says raise hand on the bottom at the left-hand side. And you need to click on that to raise your hand. And then you'll need to put your hand down afterwards. So I'll see who's got their hand up first. I've got 3. So I've got Alan, Janet and Cridwen. So I think what I'll do is I'll take those 3 questions and we'll put them to Justin and Sarah. And then I think we'll move on to the next speakers, and then people will have a chance to come back obviously at the end and ask more questions. So so that's what we'll do for now. And I'm going to, you know how ruthless I am when I'm chairing, if you start making long speeches or ask questions that go on for too long. And I can see you all smiling because you know that I will cut you off if you go on for too long. So please be concise and brief in your question, so we can get back to the speakers and ask them to answer them. So I'll take the 3 together and then we'll go back to Justin and Sarah. So Alan, you're first.
Thank you. We've heard very eloquent presentations about how so much money has been wasted on the COVID treatments. We've heard about privatisation and we've heard about the local authority funding gap. What I want to know is how can the Labour Party campaign on these issues with the council and with the MPs and force the government to change course? What we need to do is, first of all, get the MPs to really quiz what the government's privatisation plans are for the NHS, because we see this formation of the integrated care systems that the government's proposing. That's the stalking horse for privatisation, and that issue really needs to be forced through. The second thing is councillors need to argue with the councillors in the other boroughs about what's going on, because the big organisations are several boroughs in London. And lastly, the councillors need to press the GLA and set up a pan-London organisation to oppose the plans that the NHS has for London. The NHS has a pan-London organisation, and that needs to be matched by a council organisation.
Thanks very much, Alan. Okay, Janet, nice and
thank you.
Concise, please.
I think the main thing is that all of this is all of the changes of the integrated care systems and so on is being driven through without any consultation, and with people hardly able to know what's going on. And it is also not using the expertise of councillors or involving them in any way. And they are in a very good position to know that social care was in a dreadful state even before the pandemic started, and can show that, and we ought to be able to convince some of the other parties, like the Conservative Party, because privatisation of this sort is not as efficient as what we had when we had in-house expertise and so on. And all the evidence is against the measures that are being put forward, yet we're not being consulted, we're not even being told what's going on. And
Thanks, Janet.
Sarah mentioned this booklet by the National Pensioners Convention, which was Goodbye Cinderella. And I think MP Justin must have had this, because we were sending these to all MPs.
Thank you, Janet. And Cridwen.
Thank you. My question is to Justin Madders, and it's relating to the principles, Justin. It's also taking a slightly longer term look. I'm not concerned at the moment about COVID, but I am concerned about the issue of autonomy and responsibility and accountability in particular within the NHS. What plans does the Labour Party have to completely review the people who are elected to boards of trusts? Because if you look at the trusts, you can see that there's virtually no Labour Party representation, no trade unions. It's all people who you could be described as basically Conservative supporters, small c. And I think that's part of the problem, because the trusts are not actually in a position to stand up to some of the ideas that are being put forward.
Thank you, Caridwen. So I'll go to Justin first and then Sarah. If you're able to answer some of those points in around 2 minutes, I'd be very grateful to you.
Okay, and I
know that's a bit of a tall order.
No, well, you've made it very clear that you are a determined chair to get things moving. So I will stick to 2 minutes. So Caridwen talked about responsibility and accountability, and actually both Alan and Janet talked about that in a roundabout way in terms of integrated care systems that may be coming in. So I think just to deal with what Caridwen's talked about. I mean, we haven't gone into that kind of detail yet, but there's been no doubt actually the Tories across the whole of the public sector have been very organised and determined to make sure that as many of these positions are filled by their people. Those are the ones that are actually open to competition, not like heading Test and Trace and other such bodies. So I think that there's a very important question about governance there, and it's certainly something that we should look into. In terms of the points Alan and Janet made about integrated care systems, we are expecting some legislation to come forward, possibly in the first half of next year, to actually codify what's happening on the ground. We keep getting told this is going to happen. The Health Select Committee recommended over 2 years ago that that's what needed to happen, but we haven't seen that yet. And when that legislation comes forward, that really will be the opportunity for us in Parliament to really put them under some pressure about making sure that actually there are protections in the legislation to avoid further privatisation. Now we're not going to win on those points because we don't have a majority in Parliament. We're far from it, but it may be an opportunity to try and smoke out some of the concerns that people have got. But in the meantime, I think there are valid things that local authorities and councils can be doing in terms of through, if you've still got health and wellbeing boards, through those, asking questions about what plans are in place. You have the opportunity to challenge CCGs as well. So I would urge you to do that. And just in terms of some of the shorter term campaigning issues, I think some of the points Sarah's made about self-isolation payments are really important, because actually the majority of people, in fact, over 80% of people don't qualify for that at all, which is why some of the studies have shown that less than 20% of people who are asked to self-isolate are actually complying with it. We know that if you get notified through the app, you don't qualify for the payment. If you have to go and take time off work because one of your children has been sent home from school and has to self-isolate, you don't qualify for the payment. In fact, only about 1 in 8 people qualify for the payment. And if even on that basis local authorities are running out of money, that's something I think we should really be campaigning very strongly on, because Test and Trace is not going to work unless Isolate works as well. And of course, the point that she made about adult social care as well was really important. So I think I've gone over my 2 minutes already. Right.
You're a model on how much can be said in a relatively short amount of time, Justin. Thank you very much. Okay, Sarah, over to you.
Yeah, hi. So I think the issue about Labour Party campaigning and what we can do, I think there's a lot of work to be done, as all these issues say, but I think unless we're able to campaign across the piece, so with trade unions, with healthcare workers, with councillors, party members, MPs, the London Assembly members, and so on. We need your Labour's in retreat at the moment. We've lost a number of elections, unfortunately, in a row. We don't have the government we should have right now. And we have to cooperate and we have to work together to push forward these messages. I think the big advantage that we have is the public are on our side when it comes to talking about the NHS and about resources for healthcare and the public provision of healthcare. I don't think there's any doubt about that when you look at the support awards for health and care workers, for key workers and so on during the first lockdown. I don't think there's any doubt that on this issue we have we are speaking for the public, and we need to, in that sense, be confident and continue to take these messages wherever we can and raise them in whatever form we find ourselves in. It's true, obviously, anything that comes to Parliament, you're going to lose the vote because that's the maths on it, but it doesn't mean we're not right, and we shouldn't be putting a really strong and robust argument that people in the wider community can get behind and support and use as a basis for campaigning for themselves. So that's my feeling. Just briefly, in terms of what we're doing in the council, as councillors, other league members, and working with very closely across the North Central London area. So we now meet regularly. We also have regular meetings with the leaders of the CCG, which, as you know, we've already gone down this route of a single CCG for North Central London. We're currently pushing back on the idea that we have no representation on the CCG board. We have one person who's allowed to attend for us. The last meeting, they failed to send out a meeting link for that person, so they couldn't attend the meeting. So after much protest and fervent apologies from them, we've now been offered another place on the board, but we don't have a vote. So I think that also demonstrates a gap in accountability in CCGs and in the NHS practice, and what's happening in terms of the reconfiguration of NHS structures under COVID. I think what we're all worried about, we see that there's obviously an emergency and we expect the NHS to be on an emergency footing, but we don't want this to become the new normal. And I think that's the issue, is how we then put accountability back on the agenda when it's been superseded by a kind of command and control sort of approach. So I think I've probably overrun. I'm just looking at the notes I took on the points that were made. I think
don't worry, Sarah, because you will get a chance to come back at the end as well. So
okay, just to finish, to kind of reassure people a bit on the Health and Wellbeing Board chairs, I'm the chair of the local Health and Wellbeing Board. We also have a Pan-London group which meets regularly, and we try and hold the NHS to account in that group as well. And we've been raising very much the issues around inequalities, again, the Fenton report, funding, resources, and so on. So we are constantly kind of trying to raise those issues and keep them on the agenda and get a response. But yeah, it's an uphill task, I'm afraid.
Thank you very much. Thank you very much indeed. Okay, we're going to move on to our next group of speakers, and we're absolutely delighted to be joined this evening by Martin McKee, who is Professor of European Public Health at the London School of Hygiene and Tropical Medicine. And Martin is also a member of Independent Stage. Welcome, Martin. We're very pleased that you're able to join us this evening, and the floor is yours.
Okay, thanks very much. And I think you were going to put up a slide, just one slide to capture the message that I want to put across, if you can. And it's a picture of a ship in a storm. If it doesn't come up, it doesn't matter. So essentially, you've already heard a vast amount of information, and it's very difficult to add anything to that. And in fact, probably it wouldn't be appropriate for me to try to add it. But I want to get you to picture a ship in a storm and think of that as an analogy for a country going through a pandemic. If that ship is going to come through the storm, or if a country is going to come through a pandemic unscathed, it needs a number of things. The first thing is that it needs a captain and a number of ship's officers on the bridge who know what they're doing. And that's the first problem. So back in June, we looked at the countries with the top five, the five greatest numbers of COVID cases, and they were headed by Boris Johnson, Donald Trump, Narendra Modi, Vladimir Putin, and Jair Bolsonaro, all of whom have one thing in common, in that they are populist leaders. And in fact, there's a lot of literature elsewhere internationally showing that that approach to populism and a disengagement from the science has been associated with a significantly worse situation in many countries. But the problem was even greater than that, because we had the ship's officers, the cabinet who were there, and I think, and I stress that I've never been a member of a political party, I never will be, so I'm not making a political point. We had a cabinet that is, by general agreement, the least talented cabinet in the last 2 centuries, who were selected not for their ability at map reading or navigation or seamanship or whatever, but by their personal loyalty to the Prime Minister and their commitment to Brexit. So that was a problem. And then we had a captain who was somewhat disengaged, not asleep at the wheel, but by being diverted by his own family problems. And I won't go into all of those, but we're all aware of what they were. And who never really understood what the nature of the pandemic was, thinking about taking it on the chin and so on, shaking hands with people with COVID. So that was a problem. And then also, before I leave the bridge, the other thing you would like to see on the bridge is a map and a compass. And there was no map. There was no strategy. There never has been a strategy. We've never seen a minister stand up with a flip chart and all the diagrams of the flows of information, the flows of resources, some indication of how we're actually going to get out of that. So we have a problem on the bridge, we have a problem with the captain. Then, even if we had a competent captain and a set of ship's officers, they would be dependent on having a really well-functioning crew. But the problem was, had they looked around for a crew, they would have found a few people here and there, because of course they have run down the public sector over a decade. And those people that they had wouldn't be talking to each other. They wouldn't be functioning as a team. In the health service until 2012, they would have been functioning as a team. But as we know, we had the fragmentation of the 2012 Act. And there, just to remind ourselves, as many of you know, take an example of sexual health, which was divided between local government and the NHS and Public Health England. So we got the ludicrous situation in which PHE, Public Health England and the NHS actually had to initiate, had to go to court to decide who was going to pay for PrEP, for protection against transmission of HIV. So the team were going in completely different directions. So here you have a ship in the middle of a storm, bobbing around in the ocean, being pushed hither and thither, and you need a new crew. So where do you go? So in the middle of this storm, they go to the people they've always gone to. So they go to G4S, having conveniently forgotten what happened with security at the Olympics, Serco, Citel, despite reports by the Institute of Government and others, cataloguing one failure after another. And they say to these people, we want a crew for our hospitals, for our testing and tracing, for our laboratory services. We want trained laboratory staff. We want trained contact tracers. There are contact tracers in the UK, in sexual health clinics, in TB clinics, who are highly trained. You need to have a high level of interpersonal skills to track contacts in a sexual health clinic. You do not do it with a questionnaire on the end of a telephone. So these organizations did exactly what they always do. And once you decide not to use the existing capacity, this is the inevitability. I'm not going to get into the debate of public versus private. That's for people like you. But the reality of it is that if you have run down your public sector and you always go to an outsourcing company, they will only bid for a contract if it is to do something that they know how to do. And in this case, they know how to recruit people who can be on the end of a telephone and go through a checklist. They do it for NHS 111, they do it with debt collection agencies, they do it with direct marketing. And so they got all the subcontracted with the debt collectors and the direct marketing companies and so on. And then imagine that in some way, with a couple of hours training, they could somehow transmute themselves into these highly skilled contact tracers that we have in the sexual health clinics and the TB clinics. And of course they couldn't. So that then meant that we had to adopt a model of testing and tracing, which was what we call forward tracing, which involves finding somebody who has a positive test. I mean, I'm not going to go into all the details of the problems in testing because Justin has already covered a number of them. And then you ask them to isolate and ask them about their contacts and try to get them to isolate. In other countries, like in Korea, in Germany, in Finland, and many other countries, you do backward tracing, which is a little bit like solving a detective mystery. You're trying to find where the infection was transmitted. Was it in a church, a synagogue, a mosque, a bar, a hotel, a football stadium, wherever? And that involves what we call shoe leather epidemiology. And that cannot be done on the end of a telephone. It is a little bit like going to Campbellford and asking Father Brown to solve a murder without leaving the parish, without leaving his house and doing it all by phone. It's not going to work, and it hasn't worked. And of course, you have to set up a system which is based on individuals rather than families, which means that if you have 4 people in a house who are contacts, they are also, who are cases, they are also contacts of each other. So each of those individuals will be phoned as a contact, they will be, or a case, they will be phoned as a contact 3 times of the, or several times of all of the other people. So if you have 8 or 9 people in a house, the number of phone calls becomes 8 or 9 factorial, which for the mathematicians among you will know is a very large number, none of which is coordinated. And of course, if you're setting this up from scratch, you won't understand complex things like databases, and you might use an Excel spreadsheet, and you might do something which is really quite bizarre, which is to put every entry into a column rather than a row until 15,000 of them fall off the end. And in a paper published today, that has been modeled through, and the implications are probably that about 1,500 people died as a result of that mistake. So all of that with the inevitable consequence of going to an outsourcing company that knows how to do one thing, but not what you actually need to be done. And in fact, we have a rather ironic example of how, if you recall in the Olympics, whenever the G4S failed, the army was brought in the same way with mobile testing at the minute, as in the current pandemic. Initially, it was the military who did it, and then they were pulled back and it was given to G4S, and to a large extent, it failed. So here you almost were setting it up to be problematic. Now, I could talk at length about procurement. I'm the rapporteur on a European Commission report on procurement that will be out later this year. Perhaps it's suffice to say that I was very cautious that we did not have all of the examples of incompetence and corruption come from the United Kingdom. So we searched very hard to find some others in the other 27 member states. And we did. There are a few examples. But once again, the United Kingdom is out there great. It is leading the pack in terms of procurement incompetence and potentially corruption, although I should hesitate because, of course, we haven't had the court actions on that. You might, if you were lucky, then if you didn't have a crew, you might be able to call in the passengers. But of course, the passengers on our ship, the population, have been suffering from accumulating disease and so on over the last decade. So almost uniquely, we have had stagnating, or for some age groups, declining life expectancy. Now, much of my work in the past was on the health effects of the collapse of the Soviet Union. And in the 1980s, the declining life expectancy there was a signal that things were going terribly wrong in the country. And that was at a time when some analysts were looking at the Soviet Union and looking at the number of rockets it was building in the space race and thinking that the Soviet Union would move ahead of the West. But if you looked at the health figures, it was very clear that was not happening. Nick Eberstadt and others raised the alarm in the 1980s to a degree of disbelief by many politicians who actually were concerned about the progress in the Soviet Union. So when you see life expectancy stagnating or declining, then that really should set the alarm bells ringing, but it did not. So we had a problem on the bridge. We had a problem with the crew who were moving in different directions if they were there at all. But fundamentally, the problem was that we came into this pandemic in a ship that was full of holes. And we and others have documented the rise of precariousness. We published work showing that it was in fact austerity that was driving the rise in food banks. We had a population that stood out in Europe in terms of its precariousness of income, employment, food and housing. So the ship And the safety nets around it, the social safety nets, were full of holes that people were falling through. So that when we asked people to isolate, they couldn't, because they were working in the gig economy. They didn't have the welfare social safety net. They didn't have the connections, and we had fragmented the community. So for all of those reasons, it was inevitable, virtually inevitable, that the United Kingdom would end up where it was. And that is with the highest death rate in Europe and the worst economic damage. And of course, one thing I forgot to say was that in all of this, we cannot ignore the reality that at the beginning, the government was completely distracted over the last 4 years. And this is why nothing was ever followed up from Exercise Cygnus, which was in 2016, by the enormous effort of trying to plan for the multiple scenarios around Brexit, when nobody in Westminster, nobody in government had any idea, and even now, nobody has any idea of what is going to be happening on the 1st of January. And you cannot divorce the reality of the damage that has been done by this process to the United Kingdom and to the whole system of governance from our absolutely abysmal performance. So I'll stop at that. I won't go into any much more detail, but I'm very happy to answer questions, whether it be on mass testing, which we've just written a paper on, or on any of the more technical aspects around vaccines, if you want.
Thank you very much, Martin, for that really comprehensive overview. Martin, I know you've got to go shortly, so what I'm going to propose is to take a few questions now, and then you can stay as long as you can, but I know you'll have to leave before the end. So again, if you could go into the participants list and scroll down and click on raise hand if you've got a question for Martin. Brenda, I can see you. Do you want to come in?
Okay, so even at this late stage, what would be your recommendation for rescuing the sort of testing, tracing, the essential public health, and also how vaccines should be phased in? I mean, given where we are, which is not where we want to be, what would your recommendations be for what to do now?
Well, I think on the
just
testing
before you come in, Martin, sorry, we've got another question, so I'll take them together, and then you can come back. Angela.
Yeah, hello, can you hear me?
Yes, welcome, Angela.
Yeah. Actually, it was very similar in gist to Brenda's, because I agree totally with all that negative scenario, unfortunately, and I would just like to ask, what kind of hope is there, or what can we do in the present situation?
So Martin, if you'd like to come back.
Sure. You know, we really need a root and branch review of the testing and tracing system. We actually did call for a rapid inquiry in the summer, Michael, Sarah Wollaston and myself, and of course it was ignored, but there is a real need to learn the lessons. We have a system of testing and tracing that is dysfunctional by design. For the reasons that I've said, it just is not connected up, and it's a huge distraction. Now, local public health teams have done a fantastic job doing what they should have been doing all along. But, you know, that was inevitable, because when you went to Serco, there was no way that they had the negotiating skills, the contracting skills to work with all those local governments in the same way, local authorities, in the same way that they couldn't work with the veterinary laboratories and the other people that could have provided that. You just have a sort of bespoke, they decide what they're going to give you. But unfortunately, I think that the national test and trace system is frankly a complete diversion. The difficulty is getting out of the contract, because of course the contracts were let with no performance clauses, and that's a big problem. So that I think is difficult. I think there's a real danger we make the same mistakes again. We were talking about Justin was mentioning rapid testing, and I've been working with colleagues in Liverpool. There are two completely different narratives there. One, which is what the people in Liverpool are actually doing, which I think is very sensible. They talk about smart testing, which is systematic, meaningful, asymptomatic repeated testing, which is working with community groups to find out ways in which these tests, which are actually pretty good, So what is being said about them, there are a lot of attacks and criticisms on them, but they do get the result, pretty good results very quickly. But working with community groups to find out how they can be used in a practical way, whereas the government is reporting it as a mass testing that they will roll out in huge scale, again, going presumably to outsourcing companies because they'll do something very simple but will not engage with the local population. And if you look at the comms coming out of Liverpool and you look at the comms coming out of the government describing the same thing, they are quite different. So I think that's on the testing and tracing. On the vaccine, again, I'm very optimistic about the vaccines. We've just had the Sputnik results as well today, much smaller numbers. I think both the RNA virus vaccines and the AstraZeneca one, very promising indeed. The one big question there is, in September, the Joint Committee on Vaccination and Immunisation published a report which said essentially care homes and people who work in care homes first, then the over 80s, the over 70s, and working down NHS staff, and then the younger people. In France, what they've done is to prioritize, and some other countries, to prioritize some people who are working in public-facing roles in public transport, taxi drivers and so on. I think there is a strong argument for doing that as well. There is an issue, I don't want to get too technical, but there is an issue as to whether the vaccines create sterilizing immunity, i.e. they stop you getting infected and spreading it, or whether they just stop you dying from it or getting very severely ill. In a way, it's a bit academic because providing you get some immunity from dying from it or getting severely ill, even if you do get it again, that will give you the sterilizing immunity probably. And so I think the main argument, I think, given that, I think there is an argument for revisiting what the JCVI have done and to also include some of the people in public-facing roles. But, you know, I accept that there are differing views on that. And that's the logistics. So I should say, the other point is, of course, the government is attempting to get these out before Christmas. It will require a huge logistic operation, requiring an enormous number of delivery drivers and vans. And I don't think I need to point out to you that there will be other people looking for delivery drivers before Christmas, like Amazon. So this may not be the best time to try to do this. And I think it will require a great deal of thought. And just as I said that I have yet to see a map or a strategy for all of this, I would be very much more reassured if a minister could stand up with a simple flip chart explaining how all of this is to be done. Because in a way, it's a little bit like running the D-Day landings, but with, unfortunately, storms in the Channel. It's going to be quite difficult to do. And there are many countries that I would have great confidence could be doing it. If, for example, we were able to get the German government to come in and run it, I would be delighted, but they're not going to do it in the same way that the German car makers are not going to come to our rescue either.
Thank you very much, Martin. Okay, we do need to move on because we've still got two brilliant speakers to hear from. So thank you very much, Martin, and do stay as long as you can, but I know you can't stay quite to the end of the meeting. So our next speaker is Parth Patel, who is a doctor and a research fellow at the IPPR think tank. And we're really pleased, Parth, that you can join us this evening. Welcome, and the floor is yours.
Thank you. Thanks for inviting me. I'm being broadcast into your screens from not too far away. I'm in Hackney North. I work in A&E as a doctor, and I'm a research fellow at the IPPR. I'm gonna start with a disclaimer and say anything I say is not necessarily the view of the IPPR, which allows me to speak a bit more freely, if that makes sense. I'm going to speak on the four things that were sent over to me to comment on. So the first one's about COVID and inequalities. The second would be on privatisation, local authorities, and sidelining public health. The third about reconfiguration of the NHS. And the last about what can progressive parties like Labour do, what can campaign groups like Keep Our NHS Free do. I'll speak briefly on each and try not to recover any of the territory that's already been covered by people before me. We'll start with inequalities. And I loved Martin's sort of analogy with a ship. I'm going to sort of transform that into a different vehicle, just to picture it. And we'll start with a train. Let's say everyone is on a train during this crisis. Now, we all might be in different carriages in this train, but if the wheels are falling off the back, we're not going to be moving forward. And the point here is that structural inequalities fuel pandemics and it fuels spread. And we've seen that. We talked about mass tracing and what's going on in Liverpool. I mean, the inherent limitation I see there is that in some areas and wards of Liverpool, the most deprived areas, only 4% of people were signing up to the daily testing. That's obviously a flaw and a limitation. The sort of axis of inequality I want to speak most about is that of ethnicity and race, which is obviously particularly important in Haringey, and it's some stuff we've done at the IPPR looking at this. COVID has highlighted, exposed, and maybe deepened inequalities, but they didn't create them. Those inequalities are structures that determine those inequalities were already there. What COVID has done is it's made them more immediate and more visible. People talk about things like structural racism and the importance of that. Well, here's a way of framing that. If the risk of death experienced by Black people in this country was shared by those who are not Black in this country, we would have seen 60,000 more deaths from COVID so far this year. That's the scale of the impact we're talking about. And as we said earlier, you can't test yourself out of inequalities. Testing is a way of gathering information. It's about giving people information. It's a tool, but there's no point in having that information if you can't then act on it. You need to have the means to respond to that information. And we know what's driving these inequalities are structural differences in the conditions in which people live. It's about how much you have saved up in the bank. It's about what jobs you do. So that's where the support needs to come in. It's not just about test and trace. And I'm going to come on to why the fiasco of test and trace in a second, but it's about supporting people to isolate. Like Sarah said, people that can't afford to, and it's great that Haringey have that extra money for people with no recourse to public funds. Stuff like that is what IPPR has called for in the past. People in the academic community, in the research community, keep talking about this thing called race is a determinant of health, but you sort of lose fact of how crazy that statement is. Your race determines your health. How ridiculously unfair is that? So that's a little sort of whiz tour of inequalities in COVID. And there's a series of steps that the government could have done. And we've engaged with the government, we've engaged with Labour, and we've engaged with SAGE. And Labour have supported our policies that we made on tackling race inequalities during COVID. So have SAGE, quite a different answer from the incumbent administration. I'm going to go on to privatisation and sidelining local authorities. What's happened here? Right, the word chamocracy has been used a lot, chamocracy. I don't know if you can just coin terms like that. But I think if this was happening in the way that contracts are being tendered out to friends, if that was happening in Pakistan, we'd probably call it corruption. So I think there's an importance about the language you use here and trying to just call it what it is. What's going on? I'm not going to go through the details of what people have said, but I think you can trace the origins back to sort of Thatcherism and the ideology there. Big problems, crises, pandemics, big crises can only be resolved by big corporations. And I think that's still the guiding principle behind the current administration's response to the pandemic. And there are, of course, inherent flaws in that Sarah eloquently outlined. Local authorities have had public health teams for decades. Test and trace is bread and butter public health. They do it all the time. What was the point of sidelining that and going around it? We said 12 billion has gone to test and trace. Actually, tomorrow you're going to see that figure go up to 22 billion has gone to test and trace in the spending review. Compared to 300 million that local authorities have got. And that's a huge asymmetry there in funding. It's massive. But what are the outcomes? We know local authorities are not only just better at contact tracing, they're better at reaching the people who are most affected by COVID, the most marginalized populations. Reconfiguration of the NHS. And I think this is a really, really important point for me and something I'm working on right now at the IPPR. Over the austerity years, we saw the resilience ripped out of our NHS. We talk about capacity. We lost 10,000 beds in hospitals over those 10 years. We didn't replace them with the same amount in the community or invest in public health in a adequate way. Seen workforce issues. We have some of the lowest workforce numbers in the G7. We've seen our hospitals start to crumble. We've seen a huge lack of MRI machines, CT machines. We've seen no real investment in public health. In fact, we've seen the opposite. We've seen £1 billion cut from local authorities in the past 5 years, and that those cuts haven't been equal. The most deprived areas and the most ethnically diverse areas have suffered more of those cuts. So of course, when a crisis comes onto the health system, the only response to dealing with that crisis is total reconfiguration. The system was already running hot, the NHS was running hot. So when it has to respond to something like COVID, everything else stops. Over 60% of non-urgent procedures, operations, tests have stopped. Over 30% of emergency referrals have come down. The whole system, the whole health service is about the NHS really at the moment. So what's the result of that? And this is the worrying bit. We've seen a huge uptick in the number of people seeking private healthcare in the past 6 months. A 40% increase in people seeking lifetime health insurance, private health insurance. We've seen some of the private healthcare providers say that they've had a doubling in their demand for things like hip operations and cataract operations, things that will be called non-urgent by the health service. But to be honest, asking someone to wait around for over a year with a really painful hip or partial blindness isn't really something that we should be aspiring to in our health service. And I think the direction of travel that I'm worried about is that healthcare is hurtling into a two-tier system that we see in education. We've seen how the separation of private and state schooling in this country operates and the impacts of that. We've so far pretty much managed to avoid that with the NHS, despite the threats in the past. I think this is a real tipping point, to be honest. And I think if the performance numbers continue as they are, we've reversed a decade of progress in cancer survival outcomes, for example, then that's the real risk. And I think that's a key message to be pushing on. And that sort of brings me on to, I guess, the last point. I'll keep it brief so people can ask me questions, which is what can Labour do? What can campaign groups do? I think in the short term, it's about holding government up to account. And I think people before me have spoken about what we need to do in terms of our COVID response. But thinking about our next election, it's a few years away, but I think the arc of how the health services respond are going to fall quite nicely into that. The NHS is always a priority in the election. This time it's probably going to be the leading issue. We're still going to be catching up with a backlog from the COVID crisis. And what's the narrative progressive parties and campaign groups should be pushing on? Is it the old drum that the Tories are privatising the NHS, or is it actually the Tories can't run the NHS? They're incompetent at running the NHS. They don't have the ability to look after you and your family properly, because look at these numbers. We've reversed a decade of progress on cancer. Is that a narrative? And that's something we're working on right now at the IPPR. We're calling it a discourse shifting piece. It's targeted very much at the next election and trying to weave a cohesive narrative about that. I'll stop there because I know we're running quite late into the evening, but very happy to take any questions.
Thank you very much, Parth. What I'll do, if I may, is move straight on to Charmaine, and then we'll take questions at the end. And I think some of the figures you gave there are absolutely stark. And we know even before COVID in our own borough that the inequality that we have in health, and the fact that someone living in a poorer area of Haringey lives on average 15 years fewer years in good health than those in the wealthier parts of the borough. So it's very stark indeed, and obviously going to get a lot worse. Charmaine, we're going to hand over to you now. We're absolutely delighted that you can join us this evening. And Charmaine, for those of you who haven't met her before, is a local social care campaigner and social carer herself. So welcome, Charmaine.
Hi everybody. I've been listening to a lot of the stuff that people have been talking about. And obviously, we've touched on a lot of points in regards of the state of our care system before the pandemic, and I would like to discuss with you the experience as excuse my dyslexia, domiciliary carer. I used to go and visit like 10 clients a day. You know, I was a part-time worker, you know, and each appointment was half an hour. In that half an hour, you would have to, and this is in one, I can talk to about one client that basically I would have to go into the house. He couldn't barely walk. I'd have to go upstairs. I'd have to take him from his bedroom to his bathroom, undress him, wash him, dress him, escort him downstairs, feed him his breakfast, and had to do this all in half an hour, which obviously doing all that half an hour is not nowhere near enough. And if you obviously being someone who actually cares, as it's part of my job as well, I never wanted to leave anyone until I cared for them properly, which sometimes made you late. On top of that, there was the issue with travel as well. To see your clients, you were given, I could be in Hornsey, and then my next client would be in Tottenham Hale, and I would have to get on the bus and travel all the way up to Tottenham Hale in a matter of 10 minutes. So, and if, like I said, if you're late for one client, then you're late for all of the clients. So there was a big problem there in regards to that anyway. My solution around that was to ride a bike, because it's the only way I could visit all my clients and look after and give them the care that they needed. Early March, I stopped being a carer and actually become a support worker. I'm also, in my local area, I'm also a partner of an organisation called Noel Park Big Local. So we do a lot of stuff within our community as well. The pandemic has hit. Obviously, I've got this new job and I'm thinking, well, I've got to get all the way from Wood Green to Finchley. How am I going to do this? I'm a mother, I've got a child, I was scared, my mum's vulnerable as well. I just want to get safe, get to work safe and get to back safe. And I'm thinking, what about all them, sorry, something's dropped. I'm thinking about, what about all them other carers that are going from house to house? How are they going to do this with the fear of getting infected? So I thought of a solution, and seeing as that Noel Park Big Local do have money that we can give to our local residents, that we can make their lives a lot better, I thought of a project called Wheels for Workers. And within our Noel Park Big Local area, if you are a key worker and you can prove via DBS or you work for the NHS, then we will provide you with a free bike, free helmet, all the stuff, all the lights and everything. And that to me was a solution to quite a dire situation. I've heard a lot of conversation about the privatisation. I would like to talk to you about my experience in that field now, because I'm actually working for a private resident company within mental health. We do get tested weekly, COVID. We do, and we do get a lot of training. I'm more of a solutionist. I understand that what we are going through is a really, really dire situation. I mean, we're in a situation where we are backed in the corner, and I'm rather a swimmer than a sinker. And I think to myself, do you know what are we going to do about it? We all know how bad the situation is. So a few ideas. We need to start engaging with our social enterprises, our community groups. These groups are our saviours at the moment. You know, we need to be training more local people. We need to be looking at people with lived experience. Myself, I didn't have no education. I didn't finish school. I didn't do any exams or anything like that. Yeah, I've come up with some really good ideas that work, which means I've not quite passed my sell-by date, and I look at other people who also have not passed their sell-by date. And we should be investing in people with lived experience. What I found in my role as a carer, there's a lot of people that just want to earn money, and not enough people actually want to do that job because they care. They generally care. And I find if you've got lived experience and you've looked after a parent or a friend, you seem to be more compassionate to your client. And it's so, in my view, it's important that we invest in local people and these people, and with the lived experience. Now, a few solutions would be for the council to work with community groups. You know, there are funds out there. All right, we've got a massive fight with the government at the moment, but you know, unity is power. You know, and when people come to, you know, we are the many and they are the few, and when people do come together, we'll be able to conquer a lot of our problems, even though we've been put in the situation that we've been put in. Personally, we have in our Nile Park big local area, we do have a section that is allocated for vulnerable and elderly people, and I'll be quite happy in the future to work with the council, and we would like to work with the council in actually setting up some form of pilot scheme where we can collaborate and actually bring people back onto the council, working with the council, but with shared resources. We need to put our heads together, and you know, the council needs to support these community groups, because the way I'm looking at things, in the dire situation we are in now, it's the only solution. And yeah, that's pretty much. Not only that, working for my other care, the care company I worked for, I overheard a conversation. There was me receiving my £8.25 an hour, and you know, and I'm hearing that they get £30 an hour for where I'm not getting that much money. The care company's getting like £30 an hour, and I think, wow, you know, why are we not? Why have we got this problem where the council can't no longer employ local people and invest in local people? So yeah, that's pretty much my wrap on that. So any questions, please fire away.
Brilliant. Thank you so much, Charmaine. And the power is in our hands, as you say, and we've got to find those local community solutions to some of these big problems. So I'm sure there's going to be some questions. I'm going to take a few questions, and then I'm going to ask Catherine West, our local MP, to come in and just wrap up and talk about campaigning and the way forward. But we have got time for a few questions first. So if you would like to raise your virtual hand, and I will take, I'll take a batch of questions, and then I'll ask some people to respond to those. So first of all, we've got Michelle de Broglio, and then Rod Wells to start with.
Okay, yeah, I wanted to ask Parth about the numbers of people going to the private sector, because I was just wondering how many of them are choosing to go to the private sector and how many people are being diverted to the private sector. During lockdown, I was supposed to have a scan at Bart's. I've been monitored by them for the last 18 months. And I didn't get my appointment letter. So I phoned the hospital and they said to me, oh, you have got an appointment. And they told me the time and the date, but they said, we can't tell you where it is because it's not on the system. So anyway, then I got a phone call on a Friday night from somebody, I didn't know who they were, offering me a scan within 3 days. So I thought, oh, I asked them for details and I said, well, who are you? And I've already been told I've got an appointment. You know, haven't you got my NHS number? Can't you look it up? Oh no, they didn't have access to the NHS records, but they were offering me a scan within 3 days. And I said to them, look, I've been told I've already got an appointment, so I'm going to wait for my appointment. Anyway, I still didn't get the letter. And the man gave me his number to ring back in case I didn't hear from them. So I chased up Bart's again, and I got through to the imaging service. And they said, oh no, there isn't an appointment here. And then they said, I said, well, there must be, because I was told the date, this is the date. And then they said, oh yes, hang on a minute. It says here, there was one, it's been cancelled. And it says here, the patient has requested to go to another hospital. And I said, I have never, ever asked to go to another hospital. I mean, how is it that I have been diverted to private sector provider for my scan without telling me my details and my personal information has been passed on to them? And I never got to the bottom of it, but I was offered my appointment eventually. But my point is, if that's happened to me, then that is happening to many other people during this lockdown. And what I want to know is there a register anywhere of private contracts? I mean, can you go to register and see how many private contracts have been given by a particular hospital? So that's my question.
Thank you. Thanks, Michelle. Okay, I'm going to go to Rod next, and then Steve. If I can ask people to keep their questions as short as possible, because we'll get more in that way. Thanks very much, Rod.
Yeah, can you hear me okay?
Yes, perfectly. Thanks, Rod.
Very good. I just wondered, this is really a question actually for Justin Madders. There is a something called National Care Support and Independent Living Service, which is being proposed by, among others, the Socialist Health Association and Reclaim Social Care. And I wonder if the Labour Party know about this and will support this, because it seems to me that, you know, the government is going to try and bring in some sort of social care, probably based on insurance. But it would be really good if the opposition could have something that's free, paid by taxes, and talks about care and support and independent living, which is what a lot of people in under care would prefer. And I wonder if that's something that would be.
Thank you very much, Rod. Okay, and then Steve, you're next.
Just on the private sector.
Can you hear?
On the private sector thing, similarly.
Excuse me, you're interrupting me. Can I speak, please?
Oh, sorry.
Thank you. Thank you. Right. Linking up what Parth and Charmaine said, because I think actually.
Oh, sorry. I can see Steve Burak, you're speaking, and I can't see your hand raised, and it was actually Steve Hart I was calling to speak. But if you can hang on a minute, Steve Burak, I'll take you after Steve Hart. Is that okay? Steve Hart.
Thank you. First of all, on the private sector thing, I too have a bit of a medical musculoskeletal problem, and I was sent by the Whittington to the Highgate private hospital for a test, very minor test, but it just seems to me that they're using the private sector much more than they were before. We ought to keep an eye on that. But my main point is about the BME and COVID. I mean, we know the vastly excess deaths of BME communities from COVID. There's been lots of explanations, and which don't seem to me entirely satisfactory, but they're about compounding inequality and racism, you know, in education, in job, in housing, etc., etc. And that's the explanation that's given. But aren't we, as we currently stand, just going to repeat the failures of the past in terms of vaccination? Because there's no mention of race, not even employment or the other factors that have caused BME people to be dying in the vaccination. And we should be kind of reverse engineering what's happened recently in terms of the vaccination. And just an added point on that, Dan Carden in Liverpool that Martin McKee referred to was saying on TV last night that only 4% of the most deprived areas of Liverpool had been tested in this recent position. And with vaccination centres, they're talking about drive-in centres. Well, who has cars, you know, who doesn't have cars? We're very liable to repeating vaccination, and therefore have 3 to 4, 5 months of further deaths from BME. I wonder what people think about that.
Thank you, Steve. And Stephen Burak, if you'd like to go next. Stephen, we can't hear you. You'll need to unmute yourself. Okay.
Right.
Yeah.
I think there's a really important, thank you. I think there's a really important convergence between what Parth was talking about and what Charmaine was also saying. Parth actually said, what should the Labour Party do? You know, I think it's become very apparent in this Zoom that the government handing over the instrumentation of track and trace to big corporations has shown itself to be exorbitantly expensive and a demonstrable failure. Whereas you know, when the professor talked about a shoe leather epidemiology, and you know, the fact that actually local authorities who through face-to-face communication can do the process of track and trace very effectively. Clearly the Labour Party position surely should be to actually expose the failure of big corporations and the huge cost that is manifest here. And I think Charmaine actually, when she talked about free bike and free helmets to care workers, no, it's the simple processes that actually are very likely to be very expensive, very unlikely to be very expensive, that need to be preeminent in these processes, and which are sadly terribly absent. So that's my suggestion. Thank you.
Thank you very much. So I'm going to ask Parth and Charmaine to come back on some of those points. I don't think Justin is still in the meeting, but I'm sure Catherine will pick up some of the points about what the Labour Party could be doing in terms of campaigning. So Parth, would you be able to pick up the points on people being pushed towards the private sector and the point about further inequalities within the vaccination process? And Charmaine, I wonder if you, after Parth has spoken, would be able to pick up the points about the National Care Support and Independent Living Service. I don't know if you know anything about that, but your comments on that if you do. And also about finding these small and local solutions, which are often far cheaper and more effective because they're actually engaging people on the ground who know what it is that's needed, rather than going to these big corporations for those answers. So Parth, I'll go to you first, and then we'll go back to Charmaine. So Parth, if you could pick up the private sector issue and also the inequality in terms of vaccinations.
Sure. I'll start with the private sector question. And I'm sorry to hear about your experience with the health service, Michelle. It's far too common that sort of patients are residualized to something in the pathway and going around and around again. It is a good question. Privatisation, essentially, I guess, in terms of how the individual accesses care, could be thought about if the individual is going directly to a private healthcare provider, or is the CCG and the bosses commissioning a private sector provider to give that service on behalf of the NHS. The figures I quoted were about individuals, which is why they alarmed me. About 40% increase in individuals going and searching and buying private healthcare because they didn't trust the NHS, okay? And again, a doubling in demand from those providers, from individuals directly approaching them, can you do my cataract on the private care sector? That's why it's scary, because it says there's a deeper underlying profound sort of malady going on in the system where people are just losing faith into the NHS and buying and thinking, actually, I'm going to buy out of that and pay for my healthcare myself because I can afford it. That is a real risk, and why I talked about the two-tier system and compared it to education. On the system, on CCGs, people commissioning private sector workers, that is massive. And I think it was Steve Hart who said, feels like it's a lot more common. You're right, it is a lot more common. There's no direct registry for you to go look it up. I mean, we all try and find that sort of stuff, but it is happening. And I agree in the long term, that's certainly an issue, but I can see why it's happening. The impact of austerity have just meant the capacity in the NHS right now is too small. So if we want to clear the backlog, if we want to provide care, we're going to have to use the independent sector capacity. How we go about that is in the NHS's hands. NHS is far bigger than any company in the country and most companies in the world. Okay, so it can negotiate terms where it contracts out private sector capacity on a pretty good rate. Okay, that's going to upset a lot of private sector investors because the stock market, the stock value of those companies will go down, but it has that capacity. And I suspect some of that is going to start happening. On Steve's other question about disparities, the sort of ethnic disparities and vaccination, you're right. It's very likely that those inequalities are going to play out again, and there's been no concerted action or thought to address that. The government are producing reports after Kevin Fenton's report and other reports saying, oh wow, these disparities, these inequalities are quite big. They list out all the findings, and then they do nothing about them. They don't have any sort of measures in response to that. And they haven't responded to the testing, and I think it's unlikely they'll look to triage vaccination by ethnicity. I think there is a good case for doing so. I think IPPR have called for that sort of to be integrated in how we think about testing, and it ties into something called the inverse care law, something that's quite well profound. It's by Julian Tudor Hart. I say it's from ages ago, and it essentially says that the people that most need health care find it hardest to get. And Julian Tudor Hart was the previous president of the Socialist Health Association that I think someone mentioned before. I hope that's answered people's questions.
Thank you very much indeed. Yes, answered very, very concisely. Charmaine, can I come to you about the National Care Support and Independent Living Service, and also about finding local solutions rather than going to global corporations who don't seem to know what they're doing?
Right, so I can talk more. I'm not that high up in my field in the, shall I say, the social care industry. I'm a mere humble key worker. So all I can talk to you in regards of independent living is the more bigger the social circle of the person, the more independence of the living. And what I find is, I'm probably going to detrack here, is that the lack of community hubs and spaces has got a big play to part in the way in enabling a lot of people to live more of a fuller, independent life, if that's what we're talking about. When we had the COVID hit around Knoll Park, we had a massive mutual aid group which went round and helped a lot of people. They dropped food parcels, they done, dropped certificates to doctors, like they done so many different things. So as a solution, that it would, in my view, I think it'd be more working with the social groups. They do have a lot of answers for the questions in regards of independent living, like community togetherness and whatnot. Sorry, did I answer? You
did indeed. Thank you very much. And I think we've seen those mutual aid groups all over Haringey during the pandemic. And you can't really talk about a silver lining in a pandemic, but if we had to identify one, I think it really would be the way that communities have come together to support one another, and that's been absolutely fantastic.
I do think, sorry to cut you, I do think that in the phase we are now, that really we should be hitting on that, because what people are seeing is that, do you know what, who got us out of this predicament? Who got us out? Well, everyone knows it weren't the government. They're the ones who really more or less put us in this predicament. Absolutely. That's why it's so important to invest in local people and local communities, because do you know what? The only people that are going to get us out of this is us. It's not our government. It's local people. Remember, when we all get together, not on the same level, everyone can see what's going on. No one's blind. So come next 4 years' time, I reckon we'll be talking a different story.
Celia, can I make a comment on the social care question from Rob as well? Or are we short on time?
We are short on time.
Okay.
I'm really sorry, Parth, but I do want to just bring Sarah in because she's been waiting patiently. Sarah, if you can be really quick, and then I'm going to go to Catherine, and then we're going to talk about next steps.
Yeah, I just wanted to pick up on some of the things that have been raised, particularly by Charmaine, because I think they're really important about, from council point of view, working with local community groups. We have, through COVID, invested quite significantly in voluntary and community sector. We've set up a food network that brings together food banks, hot meal services, people kind of providing neighbours with food and so on, in order to try and tackle food security. We've got a programme we want, despite the difficulties with the budget that I alluded to before, we've trying to set aside new money to invest in the voluntary community sector, particularly for this reason. We can't do these things on our own, and small grassroots organisations have a kind of a reach into the communities that the council, even with the best intentions in the world, I'm not pretending we've always had them, simply doesn't have. So I think we want, we see that the only way we're going to survive what's coming down the line with Brexit, with the economic impacts of COVID and with the ongoing health impacts of COVID, is if we work together in local communities to really support one another and to do the best that we can. And just on a final note, we did just before lockdown introduce London living wage for care workers in Haringey, and we are in the process, in fact it's just finished last month, we're rolling people onto new contracts. We're trying to overcome some of those issues about that Charmaine kind of so graphically illustrated about people travelling across the borough to see clients and not being paid for that time, not being paid for waiting time, and all those sorts of things which are recognised, even if we are not the people employing care workers directly, we recognise that in terms of contracts that we're commissioning, that this is unacceptable. So we're trying the best we can to overcome those issues as well. So thanks very much. Sorry if I took up too much time.
Not at all, not at all. Thank you very much indeed. So I'm going to go straight to Catherine now. Catherine, welcome, and thank you for you've sat through the whole meeting. I'm sure you've learnt a lot, as have I, and you're going to kind of lead us into some next steps and campaigning strategies.
Wonderful.
Over to you.
Thank you, Chair, and I've learnt an enormous amount, and it was really good to hear some of our speakers who I've heard in different fora before, but not in this way, and I'm so glad to get the wonderful turnout of 70 people on the call, which is pretty impressive for Hornsey and Wood Green. So just quickly on the national picture, we have the announcement tomorrow by Mr. Sunak, and I've been fortunate enough to get onto the list of speakers. So I will be talking about the key workers' pay. It's an absolute disgrace that this government can give £21 million away to people who have no background in providing PPE to the health service. They get 21 million because they happen to be a well-placed middleman, and yet our frontline workers will not be getting a pay rise. Now, there is a suggestion that NHS are exempt from that and that they may get a pay rise, but we all know that it's also the porters, the security guards, the cleaners, the people who prepare meals in the hospital, it's our social workers, it's our OTs, and I'll be following that very closely. And we've had some really good campaigning from the TUC, from all the trade unions, to remind Labour MPs of that fact. On the question of the test, trace and isolate, we know that under 20% of people who are contacted are only isolating. So that means 80% are not, as one of our speakers said. And I think that really has to be the absolute focus of the test and trace. And yet, as Path said, we're going to be seeing more money go into the pockets of the private providers. And it is just all about funneling everything through to the private sector. So we're trying to keep an eye on it. Fortunately, the National Audit Office and the Public Accounts Committee have got lots of facts now. And if you look on their websites, you can see a lot of the detail about where the money's being spent. If that money was going into local government, we would be doing so much better. And many of us do make that point regularly in Parliament, including now. There are more Tories saying our local public health people are saying, give us the tools, give us the money to do it. So I can see that there's even a change in the House on that particular question. At the local level, very briefly, Chair, the Unison Care Charter was where many of us started out right back in 2010, looking at introducing the living wage, which, as Sarah has said, Haringey has taken the in-principle decision on, which is really welcome, and also looking at travel time and the length of time that a carer spends with a patient. But one of our earlier speakers mentioned that it's not very holistic, and that's, I think, what we have to look to for the manifesto, the national care system, because we know that there's such a postcode lottery out there. And why should those middlemen who are the consultants who are employing the likes of Charmaine and others, why should they be getting that big cut? That should be going directly from the health service or the local authority to our workforce. I would also like to see us on care homes looking at basically having a family of care homes under the local authority again. When I write to the care homes, and I've done it twice, because there are quite a lot, if you add them all up, with housing associations, Homes for Haringey, you know, private companies and all the rest, I think we should be basically bringing them all under the umbrella of the National Care Service. That would be a really big step in the right direction, because it would be able to unify and standardise terms and conditions, standards, procurement. I think we could actually save money. I really do. So that I'm hoping that I can contribute to our manifesto at that level. I wanted to mention mental health. I understand from St Anne's that there is a 20% increase in demand, particularly from young people. What the chief exec and chairman have told me is that people who already have anxiety, depression, eating disorders or self-harm have got worse over COVID, and it's because of the nature of the lockdown and how isolating it is. But that obviously there is a desperate need for more staff, desperate need for more nurses, doctors, and all of the allied staff who work to make up the mental health teams. And our community mental health teams are very stretched at the moment. I'm really, really worried that this is going to lead to very poor care. Finally, Chair, the Marmot Review, which many of you might remember, Michael Marmot wrote a very good piece on health inequalities, and he was the first really to talk about the fact that Black women are 4 times more likely to die in childbirth. That if you ask people from BME backgrounds in London, what was your experience of that particular visit or appointment with a health professional, and then you ask somebody who's not in that category, the difference is enormous. So there is a real problem there. And as Martin McKee said earlier, income, employment, food, housing. And really that's why we need a Labour government, to really address all those things. I had last week going to visit another soup kitchen, which they've got a lovely shiny van. They're going to go around delivering food, but I don't want to spend my time doing that on the weekend. I don't want to go to more food banks. I want people to know that they're secure in our society, that they have the money in their pockets to go and look after their families and to get food on the table and not have to go and ask for food. I love the community thing, but we could have community celebrations, festivals, the arts, rather than people's lives, having to save lives in that way. And the idea that the government is going to take away that £20 out of the pockets of people on universal credit, when I heard that, you know, it really is, that's the kind of thing that makes you really, really upset when you're a Labour MP, because you just know that that money's going straight back into the private companies. You know, it's not as if it's going to be spent on something else. It's going to go straight back. So big thank you to all our speakers, Celia, and let's keep up the good work and let's keep going and keep up the ideas for our manifesto for next time. Thank you.
Thank you, Catherine. And I just want to echo your thanks there to all the speakers. I think we've had an absolutely superb panel tonight. Thank you all very much indeed for joining us. I also want to thank the members of Hornsey and Wood Green's CLP's Health and Care Forum. I think we're really lucky to have such an active group of campaigners. Also the Haringey Keep Our NHS public campaign for helping us with the organisation of the event, and to our technical and comms team. Particularly want to thank Anne and Yvonne and Jill, and I want to thank you all as well for coming along and giving up 2 hours of your Tuesday evening for this very important issue, and for all the fantastic contributions you've made. So thanks to everyone and see you next time.